بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, this is the last lecture regarding the pharmacology of the autonomic nervous system. In this lecture, inshallah, we'll talk about the adrenergic antagonist. On the previous lecture, we talked about the adrenergic agonist. Now we'll talk about the adrenergic antagonist, or also termed as adrenergic blockers or sympatholytic agents. Which means by these drugs, sympatholytic drugs, alpha blocker and beta blocker. First, we will talk about the alpha blockers. Alpha blockers include either non-selective alpha antagonist, which can block both alpha 1 and alpha 2 receptors. These drugs include phentolamine, tolazolene. Both of these drugs, phentolamine and tolazolene, are reversible. They can bind to the receptor and easily can be removed from the receptors, especially if there is an agonist, competitive antagonist, such as atropine with acetylcholine on muscarinic receptors. And also alpha blockers, non-selective alpha blocker include phenoxybenzamine, which differ from these the previous two ones, in that phenoxybenzamine is irreversible because it bound with the covalent bond with alpha receptors, so it cannot be removed easily. And we mentioned that when we talk about the pharmacodynamic or pharmacodynamic antagonist. This is a type of non-competitive antagonism, irreversible, phenoxybenzamine and adrenaline on alpha 1 receptor, alpha one or alpha 2 receptors. They also include alpha blockers, the selective alpha 1 antagonist, which include brazosine, terazosin, doxazosine, and tamsulosin. And the last one, tamsulosin, this is very selective for alpha 1 subtype A, antagonist. This type of receptor, alpha 1A, occur on the prostate gland, so this drug is very selective to treat the prostate hypertrophy or prostate congestion in male patients that suffer from prostate hypertrophy. Also, alpha blocker include the selective alpha 2 antagonist. We have one example drug, yohimbine. We mentioned it previously. Yohimbine, natural occurring alkaloid, which can block selectively alpha 2 receptor, which occur presynaptically. So yohimbine can inhibit the negative feedback mechanism of adrenergic neurons, of adrenergic transmission, so it can result in increased adrenergic or sympathetic outflow. Yohimbine is considered as aphrodisiac drug. Aphrodisiac drug means drug that can stimulate the sexual desire. The pharmacodynamic effects regarding alpha blockers: they decrease the peripheral vascular resistance and decrease the blood pressure. They prevent the pressure effect of alpha agonists because they block alpha receptor. It's exactly alpha 1 receptor. So the first pharmacodynamic effects of alpha blocker is to decrease peripheral vascular resistance and so decrease the blood pressure. They produce postural hypotension and reflex tachycardia by inhibiting the alpha 1 mediated vasoconstriction. And this is one of the famous adverse effects of alpha blocker, postural hypotension, due to that because they block the alpha receptor. Postural hypotension, when you are sitting and want to stand up, يحصل collapse, يحصل postural hypotension or systolic hypotension. This is because the blood pressure should be changed from because you change your position from sitting to standing, or from lying to sitting. So this involved an immediate interaction, immediate release of the sympathetic adrenergic neurons release adrenaline, which act on alpha 1 receptor, leading to vasoconstriction, and this vasoconstriction will increase the peripheral vascular resistance, and the increase in the peripheral vascular resistance tend to increase the blood pressure, which will be suitable for the new position. So in case of the patient taking an alpha blocker, this will result in postural hypertension. Also, this adverse effects, this side effects is called Ferris dose effects, because usually occur with patient during the Ferris doses of the alpha blocker, so that by the time the patient will tolerate the drug, and this effect tend to disappear. Phentolamine is used to terminate the dental anesthesia when adrenaline is used to provide vasoconstriction. This is because phentolamine, the non-selective alpha blocker, can block alpha 1 receptor, and as we know on the previous lecture when we talked about the adrenergic agonist, we mentioned that one of the clinical uses of adrenaline is to prolong the action, the effect of the local anesthetic through providing vasoconstriction. So decrease the blood supply, so decrease the clearance of the local anesthetic drug through the systemic absorption. So if there is a prolonged local anesthesia, and we want to terminate this effect, anesthetic effect, and we know that we already use local anesthetic with adrenaline, we can use phentolamine to reverse this effect, to reverse the prolonged effect that provided with adrenaline, because phentolamine will competitively antagonize adrenaline, so remove adrenaline from the receptor, leading to vasodilatation, and vasodilatation will increase the blood supply, and the blood will wash out or will eliminate the local anesthetic, so the local anesthetic effect will be terminated. Venoxybenzamine, as we mentioned, bind covalently with the alpha receptor, leading to irreversible block, and we talked about this effect previously, leading to a long duration of action that lasts for 1 to 2 days. Tolozoline, which is also reversible non-selective alpha blocker, is less potent than phentolamine, but it have better absorption, and it's rapidly excreted in the urine. We have also prazosin. Prazosin is a highly selective for alpha 1 receptor. It has low affinity, low tendency to bind to alpha 2 receptor. It cannot produce reflex tachycardia. The prazosin relaxes arteriole and veins. It is metabolized by the liver, and the half-life time for prazosin is about 3 hours. It also has a Ferris dose effect. I mentioned that Ferris dose effect is the postural hypotension or static hypotension that occurred with Ferris doses of these drugs. We have yohimbine, as we mentioned. Yohimbine is a selective alpha 2 antagonist. It's useful in autonomic insufficiency by promoting the neurotransmitter release, as we mentioned, because the alpha 2 receptor occur perisynaptically, and by inhibiting this receptor, it leads to the inhibition of the negative feedback mechanism, leading to further release of noradrenaline, so that it's very useful in case of autonomic insufficiency. As I mentioned, yohimbine is aphrodisiac, which means that it can stimulate the sexual desire. The side effects of alpha blocker. The major adverse effects of venoxybenzamine, and mainly all of the alpha blockers, mainly especially phenoxybenzamine, because it's irreversible non-selective alpha blocker, irreversible, and can block both alpha 1 and alpha 2 receptors. Is the postural hypotension, as I mentioned, and this is often accompanied by reflex tachycardia and other arrhythmias, because this can lead to the reflex through the baroreceptors. This can lead to reflex increase in the sympathetic outflow, and this can result in tachycardia and arrhythmias. The clinical uses of alpha blocker: first, the pheochromocytoma. As we mentioned previously, pheochromocytoma is the tumor of the adrenal medulla, and we mentioned that alpha methyl tyrosine is the drug that used for this disease, pheochromocytoma, because there is an excess circulating adrenaline and noradrenaline, and the patient usually suffer from hypertension, and usually diagnosed with hypertension, patient with pheochromocytoma. We can use here also the alpha blocker for treatment of pheochromocytoma, especially the non-selective alpha blocker, phenoxybenzamine and ventolamine, because they can block both alpha 1 and alpha 2 receptors. Also, alpha blocker used for treatment of hypertension, especially the selective alpha 1 blocker, the prazosine, doxazosine, terazosin, because by blocking the alpha 1 receptors, they can lead to vasodilatation, and this vasodilatation can decrease the peripheral vascular resistance, and decrease the peripheral vascular resistance will lead to the decrease in the blood pressure. Also, alpha blockers can be used for treatment of benign prostate hyperplasia, especially tamsulosin, now, because it's very selective, because alpha 1A is a receptor that found on a prostate gland. So this drug used clinically because its target is alpha 1A receptors that found primarily in the urinary tract and prostate gland. Also, alpha blocker can be used for peripheral vascular disease, such as Raynaud's syndrome, which is a reversible vasospasm in peripheral extremities, such as the toes. Also, as we mentioned, the alpha blocker can be used to reverse the intense local vasoconstriction that provided during the local anesthesia, to prolong the local anesthetic effect, as we mentioned. This is a patient with Raynaud's syndrome, which is a peripheral vascular disorder lead to vasoconstriction in peripheral extremities. This peripheral vasoconstriction can be antagonized, can be treated by alpha blocker, so leading to vasodilatation and improvement of this syndrome. Now we'll talk about beta blockers. Beta blockers, a group of drugs that characterized by the suffix OL, such as metoprolol, acebutolol, ismolol, bisoprolol, atenolol. All of these drugs are selective beta 1 blocker. Also, we have nadolol, bindolol, timolol, propranolol. These are non-selective beta blocker that can block both beta 1, beta 2, and beta 3 receptor. You should note that there is no absolute selectivity in pharmacology. These drugs, even the selective drugs in higher concentration, also can block the other receptors. For example, atenolol is selective beta 1 drug, but in case of overdose, it also can block the beta 2 receptors. Beta blocker also, we have some drugs that belong to the beta blockers have a partial agonistic effect. We know the partial agonist. Partial agonist the drugs that can produce submaximal response have an agonistic effect when it compared with the agonist, full agonist. It can be considered as an partial agonist because it will not produce the maximal response. We have some type of these drugs belong to the beta blockers such as albendazole, acetylbutyrol, which have agonist activity. This is called intrinsic sympathomimetic activity, and this is very important regarding clinical viewpoint because this theoretically can be used safely in patients that suffer from heart failure. Now, heart failure, the beta blocker can worsen the heart failure. Generally, the beta blockers are contraindicated in patients with heart failure, but theoretically, the beta blocker that having intrinsic sympathomimetic activity, that they are partial agonists, theoretically can be used in patients with heart failure. We have labetalol and carvedilol. These two drugs block both alpha and beta receptor. Labetalol is used to treat hypertension in pregnancy because it can be used safely in pregnancy. Also, labetalol can be used for treatment of emergency hypertension because it's rapidly acting. It also can be used for intravenous. Labetalol is also used to treat hypertensive emergencies because it can rapidly lower the blood pressure. Now we'll talk about the clinical use of beta blocker. First, the hypertension. Beta blocker can be used for treatment of hypertension, often with diuretic, combination with diuretics, or sometimes with vasodilator. Also, beta blocker can be used for treatment of ischemic heart disease, such as angina and myocardial infarction. They decrease the frequency of anginal episodes because beta blocker, by slowing the heart rate and the force of contraction, they will decrease the oxygen consumption by the working heart, and this can lead to the decrease in the frequency of the anginal episode because it can decrease the oxygen demand. By decreasing the heart rate, it decreases the oxygen demand, and you know that the angina and the anginal pain usually arise from the decreased deficiency in the oxygen supply due to the coronary spasm or due to the coronary narrowing by atherosclerosis or whatever. So it can improve the exercise tolerance in patients with angina due to the decrease in the cardiac work and decrease in the oxygen consumption, and so decrease in the oxygen demand. Also, beta blocker can be used for treatment of cardiac arrhythmias, especially for supraventricular and both for supraventricular and ventricular arrhythmias. Supraventricular arrhythmias such as atrial fibrillation and atrial flutter, and also for the tachyarrhythmias, ventricular arrhythmias, ventricular arrhythmias, because it can slow the AV conduction through the AV node, and this can slow the ventricular contraction and can treat ventricular arrhythmias. Cardiac arrhythmias is effective in supraventricular and ventricular arrhythmias by prolonging the AV conduction time, slowing the conduction through the AV node. They decrease the ventricular response and decrease the rate in the atrial flutter and atrial fibrillation, not arterial, atrial. Beta blocker also can be used for treatment of glaucoma. This is by the topical administration. An eye drop, you find timolol eye drop, can be used for treatment of peripheral, for treatment of glaucoma, because it can be applied topically as eye drops. Because timolol preferred, why? Because it lacks the local anesthetic effect. This is compared with the propranolol, because the propranolol has a local anesthetic effect, but atenolol hasn't this local anesthetic effect. They decrease how can be decrease the intraocular pressure by decreasing the formation of an aqueous humor, and we know from the previous lectures that the aqueous humor, the fluid that control intraocular pressure, the beta blocker can decrease the formation of the aqueous humor, and we know that the aqueous humor is formed from the epithelial cells that covering the ciliary body. Also, the beta blocker can be used for treatment of hyperthyroidism, exactly to decrease the symptoms of the hyperthyroidism, especially the palpitation. Usually, the patients that suffer from hyperthyroidism usually suffer from palpitation. So to prevent this palpitation, and why palpitation occur in case of hyperthyroidism? Because the excess thyroid hormone increase the sensitivity of the adrenergic receptors to the action of catecholamines. Even we have normal levels of catecholamines, but we have increased sensitivity of the receptor. So this will lead to increased sympathetic effects, and the sympathetic effect on the heart will be increased in the heart rate and the force of contraction due to the effect of adrenaline. Due to that, there is an increased sensitivity of the beta-1 receptors to the action of these neurotransmitter adrenaline and noradrenaline. So to prevent this sign and symptom of hyperthyroidism اللي هي palpitation, we can give beta blocker, and actually clinically we use propranolol tablet 10 mg for this purpose. Also, beta blocker can be used for treatment of migraine prophylaxis. We have a lot of drugs that can be used for treatment of for prevention, prophylaxis of a migraine attack. One of these is the beta blocker, and inshallah when we study the pharmacology of the CNS, we can talk about this effect. Also, beta blockers can be used for treatment of benign essential tremors. Benign essential tremors is a tremor upon the skeletal muscles of the extremities, the hands and legs, especially on the hands, because we have beta 3 receptors on the skeletal muscles that on these extremities on the hands. So some of the patients that suffer from this benign essential tremor can be treated by a beta blocker, because a beta blocker is a non-selective beta blocker, can block this type of beta receptors, the beta C receptors. So the activation of this receptor, beta 3 receptor, by adrenergic agonist will lead to tremor. So you will find that one of the side effects of salbutamol, even the salbutamol, is a selective beta 2 agonist, but also, as I mentioned, there is no absolute selectivity. Salbutamol also can result in tremor as a side effects due to the action of salbutamol on beta 3 receptor. So the beta blockers, especially the non-selective beta blocker, can be used, can prevent this benign essential tremor. Last, we'll talk about the toxicity and side effects of beta blockers. First, manifestation of drug allergy, rash and fever. This can occur with beta blocker, and a lot of drugs can cause drug allergy. Increase in airway resistant bronchoconstriction, so that beta blockers should be used cautiously or sometimes contraindicated in patients with asthma, because this can lead to bronchoconstriction and can lead to asthma attack in a sensitive patient. Beta blocker can also lead to bradycardia due to the blockage of beta 1 receptor on the heart. Can lead to heart failure, so that as I mentioned, beta blockers are contraindicated in heart failure, especially or except the beta blockers with the partial agonistic effect with intrinsic sympathetic activity. This can be used theoretically for treatment of heart failure. In a person, heart failure in a person who depends on sympathetic outflow to maintain a cardiac output. So it depends on the adrenergic stimulation of the beta-1 receptor on the heart to maintain the heart rate and the force of contraction and cardiac output to maintain the blood pressure, so that these patient with heart failure should be beta blocker are contraindicated in this patient. We should know that abrupt withdrawal of beta blocker in patient with ischemic heart disease has a risk for anginal attack, because beta blocker are slowing the heart rate, slowing the oxygen demand, so that if suddenly stopped beta blocker, the heart rate will suddenly increase, and this will increase in the oxygen demand, and this will increase the heart work, and this can lead to anginal attack, anginal episode. So it is better to be gradually tapering rather than abrupt withdrawal. نوقفها توقيف تدريجي rather than sudden cessation. ما نوقفها توقف مفاجئ. Also, beta blocker can lead to incidence of hypoglycemia in diabetic patients that treated with insulin type 1 diabetic, diabetes mellitus, type 1 diabetes, who depend on insulin. The beta blocker can mask the symptoms of hypoglycemia. As you know, this patient, especially type 1 diabetic patient, can sometimes suffer from hypoglycemia, and hypoglycemia have characteristic features such as tremor, sweating, and characteristic symptoms known by diabetic patient. And this sign and symptoms will alert the patient that his blood glucose is going to be lower. So he should treat this situation either by having sugar, sucrose, whatever to increase the blood glucose. The beta blocker here can mask the symptom of hypoglycemia, because we know that the beta blocker can prevent the palpitation and can prevent the tremor and can prevent even the sweating. So this can mask a symptom of hypoglycemia. So the patient may undergoing hypoglycemia without knowing, because there is no symptoms, and this is very dangerous. This can lead to sudden lowering in the blood glucose, and this may lead to an irreversible damage, especially in the CNS. So beta blocker should be used cautiously in patients, استخدامها بحذر in patients with diabetes. Also, they can mask the symptoms of the clinical signs of developing hyperthyroidism. The same patient may developing hyperthyroidism without symptoms, and there is a progression, the disease without symptoms, without knowing the symptoms. This is due to the administration, due to that the patient taking beta blocker, because beta blocker can mask يعني تحجب mask the symptoms of hyperthyroidism. Also, beta blocker can result in physical fatigue and sexual impairment. It can decrease the sexual function. Beta blocker also can result in cold extremities. This is due to the decreased peripheral blood flow. We know that the blood supply to the extremities will lead to the blood with heat, combined with heat. So the beta blocker can prevent these effects and lead to cold extremities, because as we know that beta, especially beta 2 receptors that present in blood vessels, can lead to vasodilatation, the opposite of alpha 1 receptor, by blocking this beta receptor, we directed the adrenergic agonist directly to the alpha receptors, which result in vasoconstriction, and this vasoconstriction will lead to cold extremities due to that the poor blood supply, and rarely this can result in necrosis. Beta blocker also can lead to CNS side effects, CNS adverse effects such as sedation, depression, and sleep disturbances. This occur as bad dreams, especially these adverse effects occur with propranolol. Beta blocker, which are lipid soluble. Beta blocker can be divided into two: water soluble and lipid soluble. The lipid soluble, such as the propranolol, characterized by the CNS adverse effects because it can cross the blood-brain barrier, while the timolol and the atenolol, which are less lipid soluble, having less adverse effect because cannot cross the blood-brain barrier. Beta blocker can lead to decrease in the high density lipoprotein and low density lipoprotein value. And this is bad because we know that the high density lipoprotein is beneficial, which carry the lipids from the tissue to the liver, while low density lipoprotein carry the lipids from the liver to the tissues, so leading to precipitation of the lipids on the peripheral, on the vasculature, and in the peripheral, in the tissues, so that decreasing the percentage of high density lipoprotein over a low density lipoprotein. This is not an effect; it's an adverse effect because a high density lipoprotein is a beneficial lipoprotein, while a low density lipoprotein and a very low density lipoprotein are bad lipoproteins. Last, beta blocker can result in sometimes, especially one drug of beta blockers called bractolol. This bractolol lead to a syndrome called oculomucocutaneous syndrome, which is an eye dryness that sometimes lead to blindness. We know that the beta blocker are used for treatment of glaucoma, so it is they are available as eye drops such as timolol. One of these beta blocker tried for treatment of glaucoma, but it results in serious adverse effects, dryness and of the eye, and this dryness leads to blindness, a syndrome that called oculomucocutaneous syndrome. يعني جاي كحيلة عماها. And this is bractolol, which is a selective beta 1 blocker, has been referred to as bractolol disaster. كارثة بتاعت bractolol disaster, which is considered the worst medical blunder since thalidomide disaster. We know thalidomide disaster when we talked about the pharmacodynamic effects of teratogenesis. We know the story of thalidomide. أسوأ كارثة طبية علاجية بعد الثاليدومايد كانت هي الديزاستر بتاعت البراكتولول, which lead to blindness in some of the patients. I think